This is Talk 100.3.
12:49, a very good afternoon. We have on the phone line with us Dr. Hamdi. He's a professor and chairman of the Plastic and Reconstructive Surgery Department at Brussels University Hospital in Belgium. And he is a visiting doctor at Quttainah Specialized Hospital in Dubai. Hello, doctor. Welcome to Dubai and welcome to the show.
Oh, hi. Thank you for having me.
Right. So, doctor, plastic surgery often a hotly contested topic of debate and also a lot of curiosity around it. Wanted to know from you, firstly, what are the kind of most common procedures that you perform here in this part of the world?
Sure. I think this is related to the community and the environment. And this part of the world, probably the body contouring, that means surgery related to the body, either after obesity, also related to the aging is number one, so liposuction and a tummy tuck and a different part of the body tightening. And after that, it will come to the breast surgery, of course, with mainly using a breast implant. And finally, the facial aesthetic surgery.
Right. So these are the most common ones that you see over here. But when it comes to the demand for plastic surgery, across the world, how much do you think it has increased over the years and why?
Oh, definitely it increased significantly. And the first one was obviously related to the social media and the patient awareness about all this technique, surgery, and also non-invasive technique like injectable, skin relaxing therapy like the toxin botulinum and all of that. And what's mainly also contributed to this increase, fortunately or unfortunately, was the COVID crisis. In the COVID, people, they had to stay at home, and there was a lot of actually media online, webinar and communications, and then people, they start to stare to each other and see closely each other, and it raised significantly facial procedure, either non-surgical or surgical too. And the top of that, of course, nowadays, the social media is the promotion number one of everything. It's obviously related now to social media.
It's a lot of pressure. Has it ever been the case when somebody's come to you saying that I need this kind of reconstructive or plastic surgery, and you've told them that no, this would not be good for you, or you've turned them down saying that it'd be rather better off without it?
Yeah, absolutely. I think there's difference between good practice and bad practice. Bad practice based only on marketing and commercial issues. I don't believe that it should belong to medicine. We are, after all, a doctor, and we have really to do the best for our surgery, and our surgery for our patients. So mainly it happened, of course, and we have very clear discussion based on examination, pictures, and all other tools to explain that this procedure does not fit in the patient. And fortunately, most of these patients, they back off, and either they don't do it or they do something adapted to their situation. It should be really a essential and part of our practice that to do what really good for our patient.
Right. One very important question, which even I have wondered all my life, is that has come in from one of our listeners. Navneeta is asking, why is it called plastic surgery?
Well, plastic, it came far away from the Greek word plastikos. So plastikos is the art of modeling. So when you have to change or modify the body, it's a kind of artistic modeling. This is why we call it plastic. And plastic, it has the both sides. The reconstructive, when you use those techniques to cure disease, to cure malformation, accident, burn, cancer, mutilation, etc., or cosmetic, that means aesthetic procedure where you use some surgery or non-surgical tool to enhance a normal tissue. So all of that make it in this part of definition of a plasticos. This is why we call ourselves plastic surgeon.
But clearly there is no plastic used in plastic surgery.
No plastic. It's not. Right. It's not that simple.
Is any of it covered under insurance?
It depends, from country to country. It depends also how healthcare involved in. But if we define the pure aesthetic, mainly none of is refunded by the government.
Right.
When it comes to reconstructive surgery, of course, to a certain degree, and here it depends really on the budget allowed from government, globally in the world.
Right. So here in the UAE, are there any surgeries that are covered? Like I'm sure, like if you have to go through a surgery because of burns or accident, they might be covered, right?
Of course, those are what we said reconstructive procedure. Even we do it in the aesthetic way, but they're still related to disease, to accident, to any external role, and it is covered to a certain degree, of course, in Emirates and in all the Gulf countries, what is very important, of course, for the population.
All right, and finally, is it safe? 100% safe?
There is no 100% safe in anything in life, as you know. You still hear me?
Yes, I'm here.
Yeah,
listening to you.
Yeah. So what is the art of healing? What mainly any doctor should really practice is to use the best tools and education and experience and training to give the safest level to his or her patient. So in every consultation and before any procedure, we talk about safety procedure. This is why very important to have your environment that the surgery done in very good, accredited and high level by healthcare, like the hospital that we do the course on was Quttainah Specialized Hospital. It's highly accredited hospital for those procedures.
But I'm sure you do sensitize the patients before they go for these procedures, while you are consulting with them, that there might be these kind of discomforting episodes or conditions that you might develop.
Of course, you use right word. Is the discomfort. Discomfort is not a complication. So this is related to any procedure, surgical or medical. They are not a complication. So explain the surgery and what is expected after the surgery. Is it pain? Is it some discomfort? Is something else? Limitation of activity, and then we have to consent them about the potential complication at short term and long term. That's very important. Should be informed and also written clearly in the medical file of the patient.
Okay. Doctor, before we let you go, very quickly, one question has come in. We don't have much time. So Virendra is asking, has tummy tuck, does it have any side effects, and what is approximately the cost of it?
Tummy tuck, it has, of course, any complication related to surgery. So infection can happen, etc. But there is no long-term problem with that unless the technique was used in not the right way. Roughly cost depends on the patient itself. It's associated with liposuction, and it can vary between 30 to like 100,000 dirham. So it depends what is required from the doctor. And it's not only tummy tuck. Most of cases is also associated with skin tightening and liposuction elsewhere in the abdomen and the flank and the back too. This is why there is this big range of cost depending on what is really required.
Absolutely. Thank you so much, Doctor, for sharing those insights with us this afternoon.
You are more than welcome. Thank you very much.
Dr. Professor Hamdi there, talking about plastic surgery and everything related with it. With that, it's time for me to move on, leaving you with some great music. And of course, also reminding you again कि Style Icon Hunt 2024 जो है चल रहा है, तो मेरा वीडियो ऑलरेडी अप हो चुका है. आप रिव्यू ऑन पे देख सकते हो, और बिग 106.2 जो हमारा सिस्टर स्टेशन है, दोनों ने मिलके कोलैबोरेशन में डाला हुआ है. प्लीज़ शो सम लव ओवर देयर ताकि मैं आगे बढ़ूँ इस जर्नी में, विच इज स्टाइल आइकॉन हंट 2024. आई विल सी यू बैक ऑन मंडे.
रंगीला रे